How you been feeling, Mr. Brown?
Pretty good.
It's a scenario that plays out thousands of times a day in America. A doctor writes a prescription, and then the patient takes it to the pharmacist who fills it with a manufactured drug that is FDA approved. However, there are some people for whom this scenario does not work. Patients with special drug needs that can't be filled by FDA-approved drugs. It's these patients who benefit from the practice known as compounding.
Well, compounding is when a pharmacist prepares a product following the instructions of a licensed prescriber, generally when the product is not available off the shelf.
Traditionally, compounding was part of the time-honored relationship between doctor, patient, and pharmacist. The pharmacist modified a medicine to a doctor's specific prescription, adding or mixing ingredients to arrive at a custom drug aimed at a specific patient's needs. Today, more than 30 million prescription drugs are compounded annually, many by honest, hard-working pharmacists who provide a much-needed service to their patients, people who depend on compounded drugs as a medical necessity.
She was about 5.5 months old. She woke up in the middle of the night with a terrible cough, and by the next night she was on a ventilator in the intensive care unit. What we discovered was that she had some rare anomalies, including she only had one lung and a very narrow trachea. So she went through extensive surgery to repair the airway. She was just so susceptible to infections, constantly getting sick. The antibiotics prescribed that any other parent can just go to the pharmacy and get were not going to work for her. So we had to have compounded medications, and I don't know what we would have done otherwise.
In this case, it's easy to see the importance of compounding and how it meets the medical need of an individual patient.
Hello, and welcome to BestCreamsForPain.com. My name is Dr. Bradley. When you live with chronic pain brought on by conditions such as fibromyalgia, arthritis, diabetes, or a neuromuscular condition, or many other conditions as listed below, you know that finding a prescription using a topical non-narcotic pain-relieving cream is, well, much like searching for a needle in a haystack. Well, now we can help. We offer custom products made specifically for your condition, complete with studies to back them up. These products have such a high success rate because they are made by a compounding pharmacy, just for you. We don't offer just one formula for everyone. It is quite the opposite. Everyone gets their own formula, customized for them specifically and for their individual kind of pain. No two people have the same pain. Even two people with the same diagnosis can suffer from pain differently. With our products, you get a customized, focused drug, non-narcotic topical pain cream, composed of the best quality AFE-approved ingredients. Additionally, we represent a network of doctors which offer free consultations, who are willing to prescribe the cream, which, by the way, is potentially free for any patient, as it is covered by most medical insurance plans. And it is 83% effective in fighting the pains listed below. This can make all the difference in your daily life and help you to enjoy a much better quality of life. If you would like to know more without any obligation to you, just click the graphic below. We would love to help you today. You'll be glad you did.